Yeah.
Wow. Okay. Starting to get nervous. Nah, just kidding. All right. Let me see here. Share screen. Okay. We'll leave that there. Slide. Let me see. Current slide.
I'm going to leave it on anyway. I'm going to leave our live stream on and we'll see if it records.
Okay.
I don't know if it has to be playing in order to record is my question.
Okay.
Yeah.
All righty. See what happens.
Yeah. Okay. So the brackets of time is 12:15 to 12:25, 25 to 35, and then 12:35 to 12:55 for your presentations.
Okay. This one might be a little ragged. I haven't had enough time to rehearse compared to others, but it'll work.
All right.
The Thursday one will be our best one.
Okay. Okay, so I'm gonna go ahead and we have one more minute, and then I'll record, and then I'll admit.
You got it, my friend. Suerte.
Yes. Let me see.
I have my phone here in case you wanna.
Yes, I'll
remind me of my verbosity.
Mm-hmm. Okay, I'm gonna admit all. We're at 35, including us.
That's nice.
So let me hit record. Okay, recording now.
Good. Welcome, everybody. Welcome. My name is Hugo, and we're gonna wait a couple more minutes, just for any stragglers who are still stuck in traffic and trying to make it home for this workshop. And then we'll get started. We have a very ambitious agenda. So if you don't already have something to write with, whether you type into your notes into your tablet or your computer, or whether you write it pencil and paper, I recommend you do that, because we will email this presentation out to you next week. That way you guys can go back to any slides that I went through too fast, or you want to revisit any links, etc. And also, so you can write your questions for later on. Yeah, so I do encourage and advise you. Oh, also, so when we do meet, some of you have not met with me yet. When we do meet for a follow-up meeting to this one-on-one with you, that you have your questions ready for those that I didn't answer today, or you wanted me to elaborate on. One more minute and then we'll get started.
Thank you, Hugo. Hi, everyone. My name's Natalie. I'll be your host today. You do have the capability to unmute yourselves throughout the presentation. Just a few housekeeping. I wanted to let you know that this presentation is being recorded and live streamed on YouTube. The live stream YouTube is a new feature for us, so our apologies if it's not working properly. We're just testing it out this first time around. Hopefully, our goal is by the next workshop on Thursday evening, we'll have it down pat. Again, if you have any questions, please enter your questions in the chat box. While Hugo presents, you can enter questions in the chat box or wait until he's done with a slide and you can unmute yourselves to ask your question verbally.
And the purpose of the live stream is for the American Disabled Association Act, which is to closed caption, right? To offer closed caption for the hearing impaired?
Yes.
Okay.
Mm-hmm.
All right, well, let's get started. So my name is Hugo, and with me working with me is Natalie Rios, and we're representatives of the Student Success Center of the College of Health and Human Sciences. Okay. So Natalie, want to introduce yourself first, and I'll go second, please.
Sure. Hello, everyone. My name is Natalie. I am an advisor for the College of Health and Human Sciences Student Success Center. I am helping Ugo with the Health Professions Advising Program, and soon I will be able to advise you as well.
My name is Ugo, and I've been an advisor for many, many years. I'm also a member of the National Association of Advisors in the Health Professions. And as such, I receive regular trainings and in-service by both the National Association and from representatives, admissions representatives, sometimes deans of admissions from various PA programs. I also attend 2 to 3 workshops per year to stay current in the developments of physician assistant studies. So I feel very well qualified. In addition to that, my wife is a physician assistant, and I have many students who are already in practicing physician assistants or being trained as physician assistants. But I think my true passion for helping you, those of you who want to become physician assistants, because I once managed a community health center that served the uninsured of our community. And I saw the big need for primary care clinicians, which are physician assistants, MDs, and NPs. And one of my passions to make sure that we have access to healthcare for underserved communities. The reason for this workshop is because I do advise a lot of pre-PA students, and we go over the same material over and over and over and over. And I think it'd be a better use of our time when we do meet eventually. For those of you who haven't met with me yet, that you already have most, if not all, of this foundational knowledge that we're going to cover today. That way, when we do meet, we actually have a more productive session. All right, and today we're going to cover pre-PA preparation at the undergraduate level, the PA career. I mean, what does that entail? And what takes place during your master's in physician assistant studies training. All right, so the bulk of these slides I received from the American Association of Physician Assistants during one of my trainings. So they, I got training on how to use this, and I just modified them to update them. So the AAPA has been around for 50 years. I didn't know if many of you might not be aware that the profession has been around for at least 50 years, actually 52 years. Yeah, I started in 1967, trying to put Vietnam veterans who were medics to work, and that's how the profession got started out of Duke University. And 53 years later, it's now grown to a national organization. So what do PAs do? The name may be a little bit not inclusive as it should be. And so that's one of the debates that the PAs constantly have is what is the better name for us? We don't, what's the difference between a medical assistant and a PA? Someone who doesn't know that much, or for example, patients may often ask, why is that a medical assistant and you're a PA? Are you like slightly more trained? So that's a point of contention for the PAs. PAs do practice medicine. More specifically, and please write this down, because I encourage you to all have a 1-minute elevator pitch if somebody asks you, what is a PA? PAs are professionals. We're licensed and trained. You diagnose illnesses, develop and manage treatment plans, prescribe medications, and you often serve as the patient's primary healthcare provider, also known as the primary healthcare provider, PCP. So HMOs have assigned you to a PCP, primary care provider. And even before that, where it says diagnose illnesses, a big part of diagnosing illnesses is getting a good history, having good interpersonal skills, being able to communicate clearly, sometimes in various languages. And so I think that's missing from this definition, is to take a good history and then diagnose. This is a screenshot from the Primary Care Association of California of the community health centers in San Jose. Most of you, once you graduate from from your trainings, will be working in these facilities. So you're being trained as a physician assistant to right out the door work with primary care. Specialization, I know many of you are interested in that, will come later. What's missing from here are the county clinics. The county healthcare system, if you were to overlap that, would be out of Valley Medical Center, the public health system, and you'd have some in the east side over right, like around the flea market, some in the south side, and then right around Valley Health Center. Also, what's missing from here is Kaiser. Kaiser has several facilities, San Jose, and throughout the county. So those are where physician assistants get their first jobs initially. Some of them do work in private practice with physicians, but that's the purpose of this map, is to show you, the various levels of our healthcare system and where you guys would work. I'm gonna go to the next slide, and then I'm gonna show you a web page. Okay, so let me stop here. I know I'm clicking too fast, but I'll come back to this a little bit. All right, so can you see that, Natalie? It says leading health indicators.
Yes.
Okay, thank you. So this is a quick view of leading health indicators that impact where physician assistants practice. Okay, access to healthcare, like I mentioned earlier, the profession was created to improve access to primary healthcare. Clinical services, you'll be seeing adults, especially the children, people with chronic illnesses like diabetes. You'll be able to see children. My wife's actually trained as a family PA, but over the last 20 years, she's migrated and she does she sees exclusively women's healthcare issues, reproductive health issues. You'll be dealing with environmental issues, especially now with all the smoke taking place. And this is a slide that was created before we had the last 2 seasons of very high fire danger and bad air. You'll be treating a lot of injury, not just in the ER, but also domestic violence that shows up to your clinic. You'll be seeing maternal, infant, and child cases. Women that are pregnant and then they give birth, and you'll see them when they give birth the first few weeks of the child's life. And then later on, you'll see down here, immunizations are a very big part of what the PAs do. You'll be able to treat suicide and mental health issues to prevent. Forgot the poll. I'll do it a little later. To prevent this, you want to invest in prevention, nutrition, physical education, obesity. Alrighty. So this is just an idea of what PAs will do. Now, let me switch back, and I went and got ahead of myself and did not do the poll. So that Natalie, can you administer the poll, please? This is just to get you guys started.
Thank you, Ugo. So this is just a poll just to have you guys reflect on what physician assistants specialize in. Please fill out and complete, and then we'll discuss.
We'll do it in 2 minutes.
Okay.
I was too excited.
And again, you guys feel free, now's the time to ask your questions in the chat box. You can also unmute yourselves. We're here to help and assist you and answer as many questions as you have. So if you're done taking your poll and you have some questions, now's a good time to ask Ugo if you have any questions.
And by the way, if you feel more comfortable saying Hugo, that's okay. Some people feel more comfortable saying my name as Hugo. Ugo or Hugo.
Okay, we have one question. Do PAs have a specialty or are they general?
Going out the door of the PA program, and once you pass your exam, you're a primary care provider, so a general practitioner. But many, and I have some slides coming up to show you where PAs can migrate over through their years, through their career, and become specialists. So we'll cover that in a little bit. Good question, though. Thank you.
Mm-hmm. Another question is, even if you specialize as a PA, will all PAs be trained to give care in health indicators shown?
Yes, that is part of your training, and we're going to cover that in the second part of the session about PA training. What will you be trained in? Thank you. Good questions.
Mm-hmm. And starting salary.
That's going to be covered as well. First average, national average is 85,000 for fresh out of school. And then the national average, having a little bit of experience, goes up to 95,000. You can add about, for experienced PAs, about 10,000 for California, because we have a higher cost of living and we do pay a little better. But for first year students, it's still going to be about 85,000.
Great
But
question.
I'll have that slide a little bit later. Thank you.
There are more in the chat box, about 3 more. I'm going to go ahead and end the poll so we can look at the results. Okay, number 1, as a PA, can I specialize in very easily, yes or no? And 76% say yes, and 24 say no. Is getting through a PA grad school much easier compared to medical school? And 69% believe no, 31% believe yes. And number 3, all PA programs have the same prerequisites courses, yes or no? And majority, 78, believes no, they don't have the same prerequisites.
Right on. Good job, guys. Let me close my poll and go to my next slide. I do encourage you to revisit that health indicators, especially your public health majors. And maybe that could be something we can talk about at one of the PA club meetings about these indicators, what do they mean? Actually have something fully dedicated to it. And then we can even try to arrange for one of my PA students to do a Zoom call with us and elaborate on how those indicators impact his or her practice of medicine. The next few slides is to show you the status of the PA profession. There's increasing legislation to improve the practice of PA. So the AAPA as an association is very active politically to improve the practice and to have you guys be integrated more into the industry. Yeah, so all these slides are about that. The job market is trending up, and lately, primarily because of the Affordable Care Act, otherwise known as the Obamacare. The Affordable Care Act proposed that we increase access to primary care by ensuring more uninsured Americans. In other words, before the Affordable Care Act, there was an estimated 30 million people uninsured. Through the Affordable Care Act, that was halved. So primarily because some of our I'm not pro or con, but some of our Republican legislators reduced the impact of the Affordable Care Act. But it's a bone of contention, so it behooves you to become politically active to advocate if, once you're informed, for or against the things like the Affordable Care Act, because it will impact your profession. All right, so that's basically the profession. It's you're a health professional. You can treat patients from beginning to end. You can manage them. There's many things that are happening politically to strengthen the profession, and the job market is really, really good, and it's going to grow. And the physician assistants can't practice on your own. Like I said, the name does not imply that you see a patient and then you have to go consult with a physician. My wife is 30 years into the profession, and she consults very, very seldomly. Actually, she actually trains new graduates from medical school when they join her clinic, and they often consult with her more often than she consults with them. She will only consult with a PA, with an MD, when it may become a legal issue. Say somebody's a victim of sexual abuse, and then she has to write her document, her notes into the medical record, and then at that point she'll consult with a physician. Just say, I consulted with Dr. So-and-so, and we agreed that this is the plan to follow, because then she may be called to testify, and she wants to make sure that she has that legal backing from an MD. But that's with time, PAs consult fewer and fewer with their supervising PA, their supervising MD. People asked about that. So the slide says new PAs fresh out of school nationwide in 2015, so it might be a little bit more now. PAs made about 85,000 out of primary care. Okay. And then with time, you can make up to 90,000 and more as you migrate through the different specialties, or you can stay in primary care. Now, the thing is, be careful what you wish for, because if you decide to go through some of these specialties, you will be working longer hours, working weekends, working evenings. Uh, so it may impact your quality of life. So it's a balancing issue. Okay. Most PAs work in primary care settings, in the physician's office, in the community clinics that I showed you in that map, in the HMOs like Kaiser, HMOs or health maintenance organizations, in county hospitals, etc.
We had a question about surgery. Do PAs assist in surgery, or is it based on their specialty?
They can assist in surgery, yeah, and it takes a while to get in, into that kind of training. But that's a good question to ask when we bring a PA to campus. Like I said, later on, I'll ask. I'll definitely promote the pre-PA club. They bring one or two PAs to campus, or now through Zoom, so you guys can ask that specific question of the PAs. That's a very good question to also pose when we send you to the virtual physician assistant workshops. In other words, say one of you does have in mind to specialize as a PA and assist in surgeries. That would be a good question to ask when we invite University of Pacific physician assistant program and their recruiter to say how that would happen. Okay, but it does happen. The how-tos is better answered when we have admissions people and practicing PAs, so you can get more details on that.
Okay, great. And I do see some questions related to prerequisites and education, and we are going to be covering that during the presentation.
Yes, we will. Thank you for those questions. Keep those in mind. So the PA is a master's degree. There's very few programs that are certificate or bachelor's level. They're all being phased out, and you can expect to be in school 24 to 27 months. You will go full-time. Do not plan on your budget-wise including a side job or something, because you will not have time to work. Many schools actually have you sign a contract saying you will not work, because too often people that try to squeeze in work will end up flunking out or delaying their graduation, and the PA programs don't want that. There's two phases to being a PA. The first training is going to be what's called didactic or classroom, and the second part is going to be clinical experience. And then once you finish once you graduated from the PA program, you can practice for up to 6 months while you're preparing for the PANCE. That's the last bullet, the PANCE. I'm going to talk about that in a little bit. PANCE is a national certification exam. PA programs are located nationwide. Most of you are interested in the yellow Southwest states, California, Nevada, Arizona. There's right now currently 13 programs in those 3 states. Some of you should consider Oregon, in addition, adding Oregon to your list of schools. But there's some very good programs in Georgia, Florida, that are that come out to recruit California students to go to PA programs. So the first 2 years the first few months, is about 12 to 15 months of the didactic or classroom training. And you will study in bullet 3 clinic subjects such as anatomy, physiology, pathophysiology, pharmacology, medicine, and diagnostic skills. In other words, how do you ask what kind of questions, if somebody who presents with certain symptoms, to then order certain diagnostic tests, being x-rays, ultrasound, CAT scans, blood work, etc., and then put A plus B, the history, plus the diagnostics exam results to come up with a diagnosis. So going through your differential diagnosis. So that's kind of what's covered the first 12 to 15 months. In there, you're also going to have courses in professionalism, interviewing skills, public health and public health education. In other words, how to do health education on somebody who's diabetic or has heart disease, et cetera, and ethics. Every profession, physical therapy, medicine, physician assistant, they cover ethical issues, what you can and cannot do, what you should and shouldn't do, both legally and ethically. And then the clinical years. That's when you're actually out in the clinics. Now you'll notice that just about every program has to cover family and internal medicine, pediatrics, emergency medicine, women's health, surgery, psychiatry. And then once you've rotated anything anywhere from 4 to 8 weeks through these main specialties, then you're given up to 2 electives. That's where people interested in becoming PAs who help in surgery or dermatology, etc. You can pick your specialties then to get a taste of what a PA would be doing in dermatology or surgery or oncology or orthopedic surgery, etc. That way, you can potentially stay and have more education before you see patients once you graduate as a PA, and then go straight into the specialty, or plant the seed for practicing as a PA for several years, as then going back for additional training to migrate into specialties. During your clinical years, you'll be working under the supervision of an MD, a doctor of osteopathic medicine, a DO, a nurse practitioner, or another PA. Now, we got to talk about money, okay? It can be very expensive, all right? And so more than likely, you're going to be taking a lot of loans out. This is a busy slide, so I kind of summarized it here. Many of you will be owing as much as $25,000 for undergraduate education for loans. This is an actual fact. I just looked it up not too long ago. This is what our average San Jose State student graduates with if they have debt. And on top of that, many of you are going to go straight into PA programs. So you can expect to owe another 90,000. That's the national average for debt accumulated through while you're a PA student. So you add those up, you can expect to graduate about with $150,000 in debt or so. Okay, so just it's reality. In other words, if you don't want to owe that much, then considering a different profession, you got to say, okay, it's an investment in myself because later on we'll cover some salaries. We already did that. You'll be making easily between 85 to 95 to above that year after year. And if you graduate by the time you're 28 or so from physician assistant program, which is when the average age for graduates, for new graduates, you're going to have easily 30 to 40 years of practice. So you can pay off that debt within the first 5 to 10 years. The PANCE is the Physician Assistant National Certification Exam. You cannot practice for more than 6 months once you graduate unless you pass the PANCE. So once you graduate from PA programs, you do have about 6-month grace period. And meanwhile, you can work as you're studying for the PANCE. It does have, at least in the California schools and the Bay Area schools for PAs, they do have about a 98% passage rate the first time around. So most programs do prepare you for that. And then people, those 2% didn't pass it the first time around, will take it again within a month after that and pass it usually the second time around. Usually because they're nervous, or they were working too many hours while they should have been preparing. So, but it is a passable exam. Okay, so as far as asking questions, Natalie, can you put the link for the PA virtual on the chat, please?
Sure.
I highly recommend that you attend this workshop at least twice before you apply. It's a virtual workshop. You click on the blue link below that says registration. It's free. And it's usually conducted between 9 in the morning and 6 in the evening. Doesn't mean you have to log on for those full 10 hours or whatever. You can log on for an hour here, an hour there. And they have chat rooms. Easily 60 PA programs nationwide will have virtual chat rooms where you can go from one to the other. And then the questions that are asked, they usually type them in. So you can, in case you miss something, you can look at the questions that were asked and the answer and how the representative answered them. It's a great way to get some really, really good and practical information from many, many programs. Okay. I haven't seen the one for fall promoted yet, but if you register with them, it's free. You will get an email saying, "Oh, we just organized the fall PA virtual fair." So I attend one of these, at least one of these per year to stay current. But I highly recommend you do that. good source of information is going to be UC Davis Pre-Health Conference. There's the next one's coming up October the 4th or the 7th comes to mind. And usually you go in person, and usually it's a $25 to $30 fee. This year it's free because it's virtual. Okay, and it's primarily pre-med, but in the last few years they've grown a lot with the content for pre-PAs. And they should also have a virtual resource fair where PA programs are available for you to be recruited as well and ask questions of the representatives. My favorite for these are going to be the Deans of Admissions roundtable discussions, where you'll have usually 1 or 2 California schools and 2 or 3 out-of-state schools, and they share the information about the programs, what they're looking for, how many hours of patient care experience, what kind of patient care experience do they prefer, et cetera, et cetera. And the other second favorite is going to be the panel of PA students, where they share what their training is like, what they're experiencing in PA school, and also their trajectory, what they did to prepare to become a PA. Okay. All righty. It's time to take a little break for about 2 to 3 minutes while I ask you guys to sign in. We need a virtual sign in, so Natalie's going to now instruct me how to do that. Thank you, Natalie.
Mm-hmm. Thank you, Ugo. Again, Ugo, if you don't mind looking through the questions in the chat box while I give the attendance form. So everyone, I'm going to send you the link to the attendance form. If you could please fill that out. And again, now's the time to have any questions answered through the chat box. Thank you.
So for all the questions that I see here are going to be answered the second half of this. So I won't distract you while you're filling out the form. But if I see a question that is not going to be answered, I'll mark it and address it a little later.
Okay, thank you. So again,
good questions, though. Very good question. You guys came prepared.
Mm-hmm. So please click on the link, everyone, and fill out our short attendance form. And we'll give this a couple minutes, around 12:32, and then we can move on with the remaining of the presentation. You guys are also able to unmute yourself. So if you'd rather ask your question verbally, you may do so also.
So emergency medicine is working the ER, emergency room. So that's what emergency medicine is about. My mom passed away a year ago, and she was elderly. She had a great life. She's in a better place now. But the last 5 years, we would go in and out of emergency rooms 1 or 2 times a year. And usually the first one she saw was a physician assistant who took her history. Sometimes they finished the consult, they rehydrated her, sent her back. Sometimes they handed it off to a specialist, usually a internal medicine geriatrician, because she was advanced stage, she had Alzheimer's. But the PAs have a very active and important role in emergency medicine. You let me know when it's time to start, Natalie. Please.
Sure, 1 more minute. And again, if you guys have any trouble with clicking on the form, private message me and I can assist you as well. We're giving it 1 more minute. Yeah. Okay, it's 12:32, so you can go ahead and continue with the presentation. Thank you, Ugo.
You're welcome. So somebody asked about when a PA program is listed as provisional. That means that they were newly started and they're in the process of getting accreditation. And the accreditation is provisional. It means, we're granting you accreditation. You met all the first round requirements. We're gonna evaluate your program year after year after year. I believe they do that for 2 years. So you're provisional. If you're a PA program and you're newly started, you're provisional for 2 years, and then you're certified as fully licensed to continue training PAs. Thank you. I think it's Eric asked that question. Good question. No, not this one.
We had a question about how to reach you, how to make an advising appointment. The best way, I put it in the chat box, is to call either the number in the morning, 924 2910, or the afternoon number 924-8601. Call and make an appointment with Google. We also have the CHHS SSC website where you can make an appointment in that way too.
And thank you for asking that question. I'm going to put that information in the very last slide. But good news, the next 2 weeks are fairly light for me. Okay, so usually you'll have to wait 2 weeks to see me, but for whatever reason, there's availability the next 2 weeks. So I encourage you to log on, and you'll have lots of choices. Alrighty. So when you do apply, you'll be using the CASPA, Centralized Application Service. We'll talk about that later. And I asked you to write some stuff down. So the other thing I encourage you to write down is the PAEA, Physician Assistant Education Association. Those are actually, CASPA is a subset of the PAEA. And somehow, among all this, they're affiliated with the American Association of Physician Assistants. They're all three affiliated with each other somehow. I believe the American Association of Physician Assistants actually is the overseer of the PAEA. The PA oversees CASPA. And I mentioned the PAEA, and there's a link there, and Natalie will put that link in the search box. This is a good way to search all the programs nationwide who belong to the Physician Assistant Education Association. From there, they do have a very busy table with the prereqs. I don't really like that table. It's kind of too busy. But I would encourage you to actually go to the links that they have. Say, for example, you're interested in Marist, M-A-R-I-S-T University. It's a very good program, probably, in my opinion, equal to Stanford's program. But they're located in Atlanta, Georgia. And you're wondering how their prerequisites compare to Stanford's or University of Pacific, et cetera. You would use the PAE online to just kind of gauge it out, and then press the link from PAE and then go straight to the Marist prereqs website. So here's a quick undergraduate preparation checklist. And so many of you are in this stage right now. What is important for you as far as a career? How much are you willing to invest, not just in money, but in time, dedication, sacrifice to become a health professional? PA-NPs are pretty much the same level, about 2 years, 2 to 3 years, 24 to 27 months. Some of you may decide to go to medical school. Some of you may decide to be a physical therapist, PA, occupational therapist. So you should do what I start putting together your list of, what am I looking for? What am I going to benefit from this? What I need to invest? What's it going to cost me in terms of not just money, but time and dedication? What would be the best major for me? There is no best major for PA. There's only what's the best major for you, so that you can get these prerequisites along the line and get that additional, what I call extracurricular preparation. We'll talk about prereqs the next slide. GPA, we'll talk about that in a little bit, what kind of target GPA you should shoot for, minimum. You also got to start thinking about letters of recommendation. You're going to need at least 2, as many as 4 letters of recommendation. We'll talk about that later on as well. And I already mentioned talking about attending health career fairs, so that you can verify that the information I'm giving you is true. But at that point, you can ask deeper questions of the presenters at these pre-health career workshops or conferences. We will bring several PA programs per year to the campus. Nobody this semester, but I will bring either University of Pacific, Stanford, or Samuel Merritt in Oakland. Okay. You need to plan on shadowing physician assistants either as part of your job, when you get clinical hours, or as a volunteer. Somehow consider. You may have to take the GRE depending on which school you apply to, which programs. Related to shadowing for PAs is how to obtain good patient care experience, and I'll talk about that in the next slide as well. Writing a personal statement, I would actually encourage you, if you're seriously thinking about being a PA, write a version now. And it's going to be undeveloped. It's going to be, fairly simple. But then as you get more experiences, as you get more conferences, as you talk to more PAs, as you actually start getting patient care experience, you add layer upon layer. And the question is, why PA and why you? And I already mentioned the previous slide, researching your programs, all right? Most successful PA students apply between 10 to 12 students, okay, depending on your GPA and your patient care experience hours that you have. Some of you may get by with fewer applications, but you really should throw your net out a little bit further and wider than you might have anticipated. All right, so this is a draft because I have not updated these since this past summer. Okay, they may have changed a little bit. So this is just what I encourage you to do for yourself. Create a table where you put the prerequisites, and these are directly from the website. So Stanford does require Bio 30 and 31, and they also require micro. I'm going to change that. It's not micro 20 because micro 20 is only bacteriology. They actually require a broader sense of microbiology, which covers bacteriology, virology, fungus, and potentially protozoa. Those are pathogens that commonly cause infections. So there is micro 101 at San Jose State, but you'll need some lower division prereqs for that. And there's a course called micro 54 at San Jose City College, which would be a better course than micro 20 here. And we can talk about that later. So I got to change that and say micro 101 or micro 54 at San Jose City College. Western Health Science University is down in Pomona. It's a very good college. So that's the one, just to give you more choices. They all require anatomy physiology. They all require some sort of chemistry. I suspect Stanford's going to upgrade theirs to require Chem 1A and B. And some of them do require organic chemistry. I do encourage you at least to have Chem 30A, which is the general version of Chem 112A and B, which is organic chemistry. Because in PA programs, you're gonna study pharmacology, and having a good foundation for at least a decent understanding of organic chemistry will help you do better in pharmacology. They all require statistics, although TOR does require algebra before statistics as well. They all require some sort of psychology, at least Psych 1. Some may require additionally Psych 110. All these programs that are listed here some do require the GRE, some don't. TOR doesn't require the GRE, nor does Simon Merit nor Western. All right, and we'll talk about the GRE in a little bit. And I highlighted in yellow clinical hours, also known as patient care experience. Those are very, very important. Too many PA students underestimate the value of those. And not just the number of hours, but the quality of the experience. And I'll talk about that a little bit more. And the language you see here is directly from their websites. Okay, I won't dwell on it here. I'll cover it a little bit later as well. You'll notice that Western, down at the bottom, similarly, I didn't put it here, but USC also has the same requirement. They do require that their students who apply have at least 2 semesters of Spanish in their belt, because Western is in LA, USC is in LA, and their clinics, their training clinics do see a high proportion of the students who are patients who are monolingual Spanish speaking. Patient care experience is very important. All right. So on the left column, these are examples of things that are very strong. RN, many of you don't want to, it's probably not wise for you to invest in becoming an RN. My wife did, actually. She went to our nursing program here, and then she went straight into, after like 6 months, and she was a very, very strong candidate for Stanford's program. But it does require you to go through the RN selection process, 2 years of training, and then boom, you're an RN. EMT paramedic. Now, if you're going to do EMT paramedic, that's usually like a 4 to 6 month training program through something like Westmed or a community college. And this kind of costs you $5,000 to $7,000 for that. I encourage you to migrate once you become an EMT to become an ERT, emergency room technician. It's kind of like a medical assistant, but in the emergency room. Medical assistants, the 4th bullet down, do not practice in the emergency room, okay? Medical assistants are gonna work in a primary care setting at community health centers and at Kaisers. So the ones that require the least training is gonna be EMT, medical assisting, and nursing, a CNA, certified nursing assistant. Those are the ones that require probably the least amount of training. Now, many people ask about scribes, and I put that over in the moderate column to the right. More programs are accepting of scribing as an acceptable, minimally acceptable patient care experience. Now, in one of the earlier slides, I described what a PA can do, and I call it a continuum of care, where you interview a patient, you do a physical exam based on what you learn from the interview, from the patient history. Based on that, then you order diagnostic tests or not. And then from those three things, interview, the history, the physical exam, and the diagnostics, that you come up with a diagnosis or a differential diagnosis, and then a treatment plan, medicine or therapy or whatever. That's called the continuum of care. You think about this, a medical assistant only sees part of that. You know, you get the patient, you take their vitals, you find out what they're there for, you put them in a room. An EMT may see a little bit more. An EMT who works in the emergency room may see a little bit more. The scribe is going to see the whole thing, because the scribe will shadow a physician from beginning to end, and their job is to type all the stuff into everything that takes place into the medical record. But they don't do anything but type. They do learn a lot of vocabulary. They do get a lot of experiencing a variety of things, but they don't do actual patient care like an EMT, ERT, paramedic, medical assistant. You don't experience vomiting, bodily fluids, blood, schizophrenic breakdowns, the things that are like can really stress you out, because you're behind the physician assistant, you're in the corner taking notes. So there's like pros and cons to both of these. But just know that if you're interested in scribing, you really should check with the programs regularly, the websites and the admissions people, to see what their attitude is about accepting scribing as a form of patient care experience towards those 500 or 1,000 hours. This is kind of probably the biggest challenge. Well, I wouldn't say the biggest. GPA in the prerequisites and patient experience, to me, they're equal challenges for your preparation for applying to PA programs and being successful at that. And I will answer a bunch of questions after this related to these topics. And it's got to be substantial. This is directly from the PA Physician Assistant Education Association. Most programs, especially the top programs, do require a substantial amount of hours, 1,000 to 4,000 hours. So 4,000 hours represents about 2 years working in full time, 40 hours per week in some role, medical assisting, CNA, emergency room technician. So you really have to plan on when and how would you get this experience, and when and how would you get this training, and at what point will you be ready to apply to make sure that you're fully going to be considered for admissions. Now, some programs strongly recommend or require that you do PA job shadowing. That's, to be honest, that's hard to do. It's hard to get. Okay. One good recommendation that I saw was that I seen, and I kind of agree with this, is to develop a LinkedIn. In other words, open up a LinkedIn page for yourself. LinkedIn is kind of like a virtual resume, and through there you can find PAs nationwide. You can do a search for physician assistants, and then message them to see if you can do a virtual, or at the very least do what's called an informational interview. Hopefully some of those PAs are local, and then they may allow you to shadow them. One of the challenges to shadowing is something called HIPAA, HIPPA. It's an acronym. It basically means patient confidentiality. So many clinics, hospitals have a very strong HIPAA policy that will prohibit you from shadowing, because it might violate or it may put at risk the privacy and confidentiality of patient care. So if you're going to do patient PA job shadowing, your best probability is going to be PAs working in private practice with physicians. So you really got to hustle for that. And it takes a lot of strategy. But I'm finding more programs are accepting of you working in the profession as a ERT, emergency room technician, EMT, or as a medical assistant. And while you're there, recruiting a PA who's working with you or who you're shadowing or who you're working in the same job setting as your mentor, arranging for example, you see each other in the break room and say of an emergency room break room, and you start talking to each other, and they know that if you're there as a student, you're more than likely getting training to go to medical school or the PA program. And some of them may, hey, so how you doing? What are you going to school at? Oh, what do you want to do with this? Oh, you want to be a PA? Hey, I have to be a PA, as you can tell from my name tag. Let me know if you need anything. That's the open door. And you say, hey, could we have a cup of coffee when you're not working on a Saturday or something like that? And I like to do an informational interview. And if you come see me, I'll show you how to do an informational interview. That's a good way to establish a mentoring relationship with a PA. And then, and hopefully the PA will say, yeah, you know, if you're not working, log out. We'll talk to the director of the ER. And so you're already working as an employee, but you can shadow me as a non-employee, as a volunteer, as a favor to me and to you, given that you're an employee of Good Samaritan, San Jose, or Valley Medical Center. So that's one way to kind of go around that HIPAA barrier to become an employee, and then you already have all the training. You're an employee. You know, your risk of violating patient confidentiality is very, very low and acceptable to many employers. All right, folks, we got to hurry up here so we have room for questions and answers. Letters of recommendation. All right, so at least one letter has got to be an academic letter, and most of you are taking or have taken a course like anatomy physiology, where you're one of 100 students in the lecture hall, 25, 30 in the lab. So I asked you, how many letters can a faculty who teaches anatomy or physiology write for that class of 100? You know, I've asked faculty that, they say I may be able to write 2 or 3 per class. That's one thing. The other thing is you took that class when you're a frosh or a sophomore, and then 4 years later you're going to apply to the PA program. Many of you have not stayed in touch with that professor who you got an A with, who you impressed because of you asked good questions in class, you came prepared. Maybe they saw you in lab, you know, running like a little study group, helping others. You submitted wonderful lab reports. Or you came to office hours and you asked really good questions. And then somehow during office hours, you got to know each other a little bit better. That's how you develop a relationship with a professor. But then it behooves you to stay in touch with that professor and let them know that, you know, that you're really enjoyed that class. You learned so much from it. And honestly, not just brown nosing or kissing butt to that professor. Honesty goes a long way. They can read that. And staying in constant touch, you know, 1 or 2 sentence emails every semester, every other year, etc. Let them know what you're up to, how your training is, how your preparation is going. That's one good way to do that. Another way to do that is to just ask the professor to write that letter while it's hot. Write that letter that summer, right after the class, and then keep it in either in their files someplace, or there's a letter writing service, and I can't remember the name right now, where you can pay a $25 fee per year. It's like a bank where they can email that letter and it stays confidential, because these letters have got to be confidential. It means you haven't seen them. Once you've seen them, then it ruins the validity to most programs. Because if they're confidential, they can say bad things about you if that's what you deserve, or maybe that person has a biased opinion of you and they wrote something bad. So, anyways, so there's a whole science and a whole art to getting letters of recommendation. I just gave you the summary of that. When you come and see me, and actually we're going to cover this. We're going to cover a lot of these concepts or tips in April when we do our application workshop for the PA program. because some of you are getting ready to apply in the very near future. You really need to start fine tuning some of these preparation things. Okay, so I just gave you snippets of what to do. I will elaborate this with more time when we focus specifically on those getting ready to apply. So that's for both faculty letters and for shadowing letter, patient care experience letters. The GRE is going to be covered more in detail at our application workshop, but just know there's a standardized test. I think it's a little bit easier than the SAT, but there is a whole strategy to it. Basically, depending on the program you're trying to get into, some of them may require that you have at least the 40th percentile. In other words, your top 40th percentile for that specific test. And usually most students will do well with at least 4 weeks of solid prep, usually the summer before you apply. We'll talk about that some more later. Personal statement, basically, why PA, why you? And for many of you, it'll start with what I call the catalytic moment. You went to go see a PA, or you went to a conference, and then that got you really interested in becoming a PA. That catalyzed your reaction going forward. And then and on top of that, you added a series of experiences, at volunteering, volunteering at the homeless shelter. Maybe you did an international experience through to a global health network agency, and that was transformational. Then you started working, and you became a peer tutor. All these things, cumulatively, have contributed to your development, and the attributes that you would offer to the profession, such as empathy, cultural competence, cultural relevance, language relevance, your understanding of primary care and social determinants of health and how they apply to chronic illnesses, things like that. Those are all attributes that will shine when you write a good personal statement. And I'm actually very good at this, and I would have a separate personal statement writing workshop in spring as well. The 5,000 characters is 1 page, maybe a page and a half, single space, 12-point font. When I coach personal statements, I encourage you to write 8 or 9 or 10 pages, and then over a series of months and as many as 10 to 12 versions of this, you'll condense it down in a very readable way to about the 5,000 characters. Okay. So we're almost done, and then I'll take a bunch of questions. Yeah, so begin seriously prepping either in the spring before you apply. And applications open up, I believe, in May. I haven't visited this recently, but I believe that applications open up in May. And it's many schools are on what's that called? It's when as soon as they get, I forget the term. It's when it means that they're seeing the applications every week. Others will say, well, we're going to wait till our deadline, and then we're going to start processing them. So it behooves you to apply early if your application is ready. So many people will try to meet the early application timeline, but their personal statement is less than fully developed. Their letters are not, well coordinated or well organized. Maybe you're preparing for the GRE at the last minute. So my philosophy is apply once, get in, even if it means you delay your application by 1 year if you're not fully ready to be competitive. Because every time you apply, it's an emotional and financial toll on you. Okay, so that's the way I work with people, and usually I'm about 90% good on that strategy. Sometimes about 10% of my students will have to apply a second time. I think these are all, they can wait till our application workshop. All right, I know I rushed through this because I want to leave time for questions and answers. By the way, we said till 1 o'clock. I'll be here till 1:30. So those of you that have to leave, because you have another commitment, you're welcome to do that. But for the rest of you, I'm going to stay up to 1:30. Now I'll hand it over to, first of all, I want to promote the Pre-PA Club, okay? Those of you who are interested, if there's a member of the Pre-PA Club here, please unmute yourself and promote it. Meanwhile, Natalie is going to put on the chat room the link to their email address in case you're interested in joining. So you can email them, say, I'm interested in joining. Somebody will get back to you in a very short manner. If not, can somebody who's a member of the Pre-PA Club unmute yourself and verbally invite them? I guess the Pre-PA Club's not present.
Thank you, Ugo. I put in the chat box the Pre-PA Club email, and I put also in the chat box the survey for today. Our dean wants to know how we're doing, and to better assist you, we created a small little survey. If you could please fill that out using the link in the chat box. And let me go ahead and see if I can put in that link again. If you're having trouble with it, I can go ahead and assist you guys privately as well. Now's the time. If you need to use the restroom real quick, go ahead and do so. And then Ugo will address any questions you may have. You'll be able to unmute yourself. And again, I'll go ahead and see if I can assist anybody who's having trouble with the survey. Thank you so much for joining today. Again, once the survey is complete, and if you don't have any questions, you're free to log off. And I can resend the link again because I'm seeing some people have some issues with it. Okay, so that's the survey I put in the chat box again. And let me know if it doesn't work for you.
I'm going to go through the questions and see if there's anything that I didn't answer.
Okay.
So do you need a master's to become a PA? No, you do need a bachelor's because once you graduate from the PA program, you will have a master's in PA studies, physician assistant studies. So you need to have a bachelor's before you get accepted. You can apply while your bachelor's in process, but you don't need a master's to become a PA. You will end up graduating as a master's. Somebody asked earlier about whether the prerequisites can be taken at a community college, and the answer is yes. That I know of, no PA program discriminates against students who took their prerequisites at community college. They give them equal value, whether you take your anatomy at a San Jose City College or San Jose State. Whether you somebody asked about pharmacology as well, or medical terminology. Those are community college courses. There is a basic pharmacology course. It's fascinating, by the way, that you could take at a community college. And there's also the medical terminology course that's offered at community college. But San Jose State does not teach either of those courses. For those of you who have pretty decent Spanish language skills, we do at San Jose State have a fairly new course called Practical Spanish. And that one is tailored for people who want to work in medicine, healthcare workers. So consider if your Spanish is pretty decent, at least I would say through 25B. So Spanish goes Spanish 1A, 1B, which is introductory Spanish, and then the next level up, medium Spanish, 25A and B. If you're interested in improving your Spanish skill, that's a good place to do that. Let me see here. So yeah, I know I covered a lot very, very quickly, and I hope you were taking notes on the questions you still have and you want to elaborate on with me. One thing that I suggest is if you're a frosh, let's do a 2 to 4 year graduation plan, and when and how you would take these prerequisites. Factoring that you may consider doing these over the summer at a community college or after you graduate. Some of you who are not science majors, biology majors, may consider doing and we'll talk about that when we meet, a minor in chemistry, because chemistry that will allow you to get most of these prerequisites while you're at San Jose State. But then, and we'll also try to incorporate your choices, what you might want to do for getting that patient care experience. I'm not going to tell you what to do. Too many students will ask me, what should I do? And because it's not my choice. You're the one that's going to invest money in training. You're the one that's going to have to maybe take a gap year or two to get that patient care experience. So there is no formula for it. All I can do is give you the information, and then you make the best plan for you. Okay. All right. So now I'm going to ask you to, whoever has a question, to unmute yourself and ask that question. Edna Ayo, you're a graduating senior. Will you still be able to join the pre-PA club? To be honest, you probably wouldn't benefit much from joining the pre-PA club at this point. Edna Ayo, you're still out there. I would recommend you meet with me, and let's create basically an exit plan. Maybe it might require a 2-session meeting. 1/2 hour. Let's get a lot done, and then we'll clean it up the second half, the second meeting, just to make sure you have a good plan to prepare after you graduate. Okay, Monica, do you have a question for me? Monica Naranjo.
No, I was because it just said in the chat that you can unmute yourself, and I was just testing it out.
Okay,
Yeah, sorry.
tell me about yourself. Where did you go to school?
Well, I'm a sophomore at San Jose State right now, and I'm a bio major.
Right on. So you got this email through the bio. We sent out an email through the bio majors.
Yeah.
Good. So what got you interested in becoming a PA?
Well, I wanted to do something in the medical field, and I kind of recently learned about the PA career path, and I learned how it was kind of flexible with different specialties.
Yeah, good, good. So somebody asked earlier whether I'm answering the question in general, Monica, but thank you for sharing that information. You're welcome to ask more, but let me just answer the question that was asked earlier related to this. How does PA training compare to medical school? Medical school was much harder, much harder. But PA is no slouch. I had a student, every student that's gone on to PA program, we usually reconnect after their first year, and I asked them the second, how was it? And they all say, it was harder than I expected. And I had gone to workshops, I had attended sessions where the PA students talked about how hard it was, but you have no idea. It's doable, but it's no slouch. They said they averaged 20 units per term, 20 units of hardcore science. And, and even after the classes, you're still basically studying until 12 o'clock, 2 o'clock in the morning. And you're doing this 5 days a week, sometimes 7 days a week. So, you really got to be prepared. And, oh, I didn't go over the GPA. Somehow my slides got lost. Darn it. When I send out this PowerPoint, I will include the GPA slides. So roughly, you should shoot for a 3.5 GPA in overall and in your prerequisites. However, the caveat being that most schools have a standard deviation of a 0.25 to 0.35. That means that if you imagine the bell curve, for those of you who take statistics, the 0.35 would be in the middle of that bell curve. And then to the left, they are accepting students with 3.2, 3.3s. And obviously on the upper side of that bell curve, there's a 3.8 students, some 4.0s. What that standard deviation means that 60% of the students are getting in between a 3.2 and a 3.7. That's what that standard deviation means. The other 20% are getting in potentially with a minimum. Most schools have a minimum cutoff of 3.0, and some of the students are getting in with 3.8 and 4.0s. That being said, there are some 4.0 students, 3.8 students getting rejected because their their letters of recommendation and personal statement did not synchronize with the goals and objectives of the mission of Stanford, of University of Pacific, et cetera, et cetera. So your goal is to get as close as possible to that 3.5, certainly be above 3.0 before you apply, and have an upward trend in your last 60 units, or at least a consistently trend above a 3.3, 3.5 your last 60 units. Okay, sorry about that oversight, but I was, scrambling. But I will amend these slides to show that information, and when we email it out to you, now that you register with us, you will receive those slides. Okay, questions?
Hi, I was wondering if a physical therapy aid would be considered a strong patient care experience.
Some program may value that, but remember I talked about the continuum of care where where as a physician assistant, you're gonna interview a patient to get their history. You're gonna, from that history, you're gonna do a physical exam to find out, listen to their lungs, check their heart rate, check their skin, check the wound, some kind of physical exam. And then the next step is to order some kind of diagnostic test, blood test, hemoglobin A1C, diagnostic test, ultrasound, X-ray, CT scan, and then you put all that together, all that information together, come up with a differential diagnosis. So the question that I would ask if I'm a representative of a PA program, say University of Pacific, I would say, as a PT aide, what proportion of that continuum of care did you participate, did you see, did you experience?
Oh, okay, thank you.
Yeah, so some schools will count it, but you really should get primary care experience. And that's why I recommend EMT, ERT, medical assisting. Now, here's Jasmine, let me qualify what I just told you. Potentially combining PT aid with scribing, that might work, because as a scribe, you are seeing the whole continuum of care. You're learning a lot of medical terminology. You're seeing everything from trauma to a child with 105-degree temperature at 2 o'clock in the morning, and what the PA does to determine that it's an ear infection treated by erythromycin or whatever. And coaching the young mom, 17, 18-year-old mom, sometimes you get young moms, how to take a temperature, how to give them the right dose of antibiotic and Tylenol to bring the temperature down. So PAs do a lot of patient education, and that's, my wife's a PA, like I said. And one of the things that I've learned, and oh, I forgot to tell you this, I also managed the clinic for 5 years, a primary care clinic, where we hired a lot of PAs, and I was in the admissions and the interview committee for when we hired the PAs. And so I got to see PAs work in that setting. And one of the things that I appreciate about PAs is that they're part of their culture versus comparative medicine is that they do invest more time in the clinical setting to patient education. It's just part of their attributes. I'm not saying doctors don't communicate well, but I think in general PAs are selected for increased communication skills compared to a PA to an MD. In most clinical settings, MDs are expected to see between 25 to 30 patients a day, just to make break even ground. PAs are expected to see 18 to 20. So you don't have the same productivity demands as MDs because they expect you to spend more time with the patients. All righty. So I know that's a long way to answer your question, but I thought I'd weave in some of these other important factoids. How does that sound, Jasmine? Combine PT with scribing, and then once you have your plan, I would attend one of these workshops where you get to ask an admissions director, "Hey, this is my plan. How would your admissions committee perceive that plan? Would it be like okay, or they might give you some constructive feedback, like as far as how they would perceive that combination of experiences?"
Okay, thank you.
You're welcome. As you can tell, we adjust on the fly depending on where you're coming from.
So considering what you said about the patient experience, I'm currently a phlebotomist. would that not be like good patient care experience? But I'm also a CNA, so would that be like a good route to
So
take?
yeah, many schools do accept phlebotomy as a acceptable way to get your hours. But now I'm going to ask you the question: when you write your personal statement and you talk about wanting to be a PA, how will that experience enrich, your preparation and your understanding of what it means to be a PA? Because as a phlebotomist, you're going to receive a patient, and you're going to get an order from the clinician ordering a tiger top, a lavender top, some kind of drawing blood order. And then you see that patient. You're very good at finding small veins and puncturing that. You're very good at processing samples, but then you have no context as to why that patient was there. You don't have no context of what history they presented at the clinic to be seen. You have no context why those tests were ordered. So it doesn't really, in my opinion, and I've been in many clinical settings, it doesn't really add meat to the reason of why you want to be a PA. Does that make sense?
Yeah, thank you.
But you want to get experiences that do add that meat. And the CNA may offer you that experience for you to add more meat to what a PA does, the good and the challenging, the rewards and the challenges. The challenges, for example, in the earlier slide about indicators of health, in there it mentions opioid addiction as one of the biggest challenges this country has. And so, the negatives would be that you're going to be hustled by addicts. Some of them who look like accountants, some of them who look straight out of the streets. You're going to be hustled by them, and they're going to try to get you to prescribe pain medicine. And so people are lying to you, all right? That's it's challenging. You'll see the worst of human behavior. On the other side, you see the best of human behavior. The example I can give you is, my wife mentions a PA, and it's not uncommon for her we're out shopping in the grocery store, and people tap her on the shoulder, "Oh, you work in such and such clinic. You saw me for my child, and when I was pregnant, and thank God it was a good delivery. Thank you for all the care that you did." And look, and she's like 18 years old now. she's look at her now, or look at him now. And so it brings a big old smile to my wife's face when she sees that. Another good story is there was a lady who came from an international community, came to visit her daughter. And she was 65. Unfortunately, she experienced some vaginal bleeding. So my wife saw her, and she said, "I have to do a pelvic exam." And the lady goes, she turned like all colors of white. And she goes, "Nobody's ever seen that part of me except my husband." And my wife, she has a very good affect. You look at her, she's got a good smile, nice tone of voice. She explained, "This is what's going to happen." And so we'll honor every sense of modesty for you, so that so you feel like you weren't violated, etc. And she took her time. Something that should have taken half an hour. She extended out 45 minutes. She let her patients know she was going to be late, because she wanted this lady to have a good as best possible experience. Well, when the pelvic exam started, the lady asked for a blanket, and she put it over her face. She didn't want to be seen. She didn't want to be seen as she's being examined. It was so cute, my wife said, and that was like around September, October. The lady was going back to her home country, and right around the holidays, right around Christmas, and she showed up at the clinic with a basket of food for my wife. She goes, "Thank you for taking good care of me. You found what I had. You stopped the vaginal, you stopped whatever I had." And I wanted to thank you. And she brought her some food. And my wife said, "I get that fairly frequently." So again, the negatives and the rewards. And you want to be able to, as whatever experience you have, you want to be able to experience both, and be realistic about what you'll be doing as a future PA. So that's what I encourage you to look for when you're looking for patient care experiences, to get that sense of realism of what you'll be doing.
Okay, thank you.
You're welcome. Thank you. Great question.
Hi. So I also had a question. I'm planning to graduate next semester. So if I wanted to kind of go over with you, like an exit plan type thing, should I just email you?
No. Contact those numbers that Natalie's put on the screen, 408-924-2910. In the mornings, in the afternoons, 408-924-8601. She's in the chat room. Because if you email me, I'm just gonna have to take an extra minute to write you back, say, call these numbers. I don't make my own appointments. Our staff handles my schedule. They keep me very, very busy, and they want to keep me very, very busy. So they ask that you go through them to schedule me. Good question,
Okay.
Eric. I look forward to working with you. I'll keep an eye out for your name. We'll
Awesome.
hopefully see you next week.
Awesome. Thank you.
Take care now.
I had a question.
Yes, Julian.
What do you think about like taking a gap year off to focus on like patient care? Like, say like you want to focus on your GPA now. Like, would that be viable?
When I send you the slides, I know I went through them pretty fast. Look in the data for admissions data, and it says that the average age nationwide for first year matriculating PA student is 25 to 26 years. So most students have invested in getting all their T's crossed and the I's dotted with regards to GPA, with regards to patient care experience, with regards to letters of recommendation, so that they do it, so they apply once and do it right the first time. So yeah, so nothing wrong with a gap year or two, okay? And that would be validated or confirmed when you attend one of these, hopefully UC Davis virtual conference coming up October 7th. And hopefully they'll have a panel of PA students, and they'll share their story. And they'll talk about how they took 1 or 2 or 3 years before they applied. Okay, so that's me telling you that, but it should be validated when you see the data and you hear other PA students talk about their path to PA programs. Thank you.
I see. All right. Thank you.
Hi, my name's Paris. I have a question.
Hi, yes, please go proceed.
So on the slide that you put up about like the programs in California or the different programs throughout the whole nation, do you know like where like which schools are most impacted, or like
California schools are going to be the most impacted. New York schools are going to be the most impacted. Schools that they're least impacted are going to be Arizona, Georgia schools. So to get an idea of some of the least impacted schools, attend that UC Davis pre-health conference, because you'll see who's recruiting.
Oh, okay.
Yeah, they always have what's called a resource fair, and in that resource fair is going to be recruiters from different programs, medical school and PA school. Most medical schools have a PA program as well. But anyways, you look who's recruiting, and then ask them that question.
Okay. Thank you.
And the question should be phrased: how many applicants do you have? And how many seats how many students do you accept?
Okay.
To me, a very impacted program would have something like over 400 applicants and around 60 seats.
Oh, okay.
The least impacted programs would be 350, 300 applicants to 60 seats. Schools tend to average around 60 to 100 students per class. They're not big classes.
Okay, thank you.
You're welcome.
Hey, Hugo, we had a question about the location of the UC Davis conference. Is that a webinar this year?
It's going to be virtual. Yeah, it's going to be free and it's going to be virtual. It's going to be a webinar type of situation.
Okay, I put it in the chat box again for anyone that missed it.
Yeah, I just signed up before this meeting. Took me all of 1 minute, and it's free. How about Nalin or Naylan? Do you have any questions for me, Naylan, Nalin? How about Kimberly?
I do have a question.
Sure.
So I'm a microbiology major right now. And when I spoke to advising, they were saying that I have like a crunch number of units to graduate with.
Mhm.
And since the anatomy and physiology classes aren't like part of my major,
Yeah, there are 4 and 5 units each. Yeah, it's gonna take you over.
so I would have to take those at like another CC.
Yeah, you could take them at a community college. Like I mentioned earlier, the PA programs do not discriminate. They don't value any less these prerequisites at community college.
Oh, okay. Thanks.
You're welcome. How about Bailey? Bailey, ask me a question. How about if you ask me, am I going for the Oakland A's or the Chicago White Sox for the Major League Baseball playoffs they're playing right now? I'm going for the A's, by the way.
I'm a senior, and I needed to get my prereqs at a CC, and I wanted to like also get become like a medical assistant. What could I get the prereqs while doing that program?
You bet.
Okay.
Yeah, becoming a medical assistant is not hard. I had a student who was majoring in public health as a senior, and she paid I think $12,000 for a 6-month certified medical assistant training program, and it's in Santa Clara. I know she was going to Santa Clara for that training, and she met for class on Wednesday evenings from 6 to 10, and Friday evenings from 6 to 10. And she said it was compared to anatomy physiology, it's not hard. Okay, so then once she got her training, she graduated from San Jose State, and her first job she was making $22 an hour. So she paid off that $12,000 loan that she took out within the first year, and in the process, she got her hours within the first year, and she applied, and she got easily she got in her first year. She obviously she had a decent GPA, but that worked out well for her to invest in herself. $12,000, paid it off the first year while she was working, making $22 an hour and getting those valuable patient care experience hours. That's a very solid plan, baby.
Thank you.
Mm-hmm.
Looked like Nayland had problems unmuting themselves, but their question was if it mattered what class they got their letter of recommendation from.
It doesn't matter. It matters more what they say about you. Okay, so for academic letters, they're looking for evidence of critical thinking, problem solving, being prepared, professionalism, being constructive in class, teamwork. So usually it's a class. How do I show teamwork? The labs. Labs is a great place to demonstrate teamwork. That you're helping others, that you're constructive, you come well prepared for labs. So sometimes, say it's an anatomy class and you have somebody else teaching the anatomy lab, you can ask, and the anatomy instructor is not a PhD, whereas the lecturer is a PhD. You can ask them to tag team. The letter's basically written by the anatomy lab instructor and co-signed by the lecture instructor. So the degree doesn't matter. Okay, it can be written by somebody with a master's degree. What matters is what they say about you. But in that scenario, if the instructor of the lecture instructor is overseeing the whole class and the anatomy instructor kind of works for him, if they can, co-sign that letter, that's going to be a little bit more valid than just one signature. But if you only get is one, that's better than nothing. If you only get is one signature on that, and that's by the lab instructor, that's good. So it matters what they say about you.
Thank you, Ugo.
Mm-hmm.
We have about 2 more minutes left for this workshop, you guys. So if you have any other questions, please feel free to ask.
Yeah, and so this whole strategy about getting letters of recommendation, it's really an art form, and that's something we can coach in person when you come see me. Say, look, you know, I want to get a letter from here. Can we kind of strategize on what's the best way for me to do this? And we'll ask about about the instructor's personality, about how the class is structured. I know many students are shy about going to office hours, but that's a great way to get that to start that that advice